So here we have our sterile mask. This hasn't been used yet. And what we're really using the mask for is two parts. One, if you're an individual who happens to be infected, then you're at risk of transmitting the virus to other individuals. And so where the virus is being caught is on the inside of the mask. And then likewise, if you're an individual trying not to catch the virus, then say if you're out in the public and otherwise, or exposed to an individual, the virus is entrapped on the front. So these are the areas that you do not want to touch once you've been wearing the mask and the mask has now been exposed to virus particles. So first I'll put it on. So now the mask is on, and let's say now I was out in the public and virus was exposed to this particular part of the mask here. Or again, if I was a carrier and virus is coming out. What I don't want to do is I don't want to touch the front of the mask and I don't want to touch the inside of the mask. And so the proper way to take it off is to use the elastics in the back. And you can undo them here, and then this would be how you would do it. So your hands stay clear of both the inside of the mask and the outside of the mask here. What we know about the virus right now is that it's actively being spread predominantly from human to human. But then you have to ask the question, how is it being transmitted, say, if I was positive from me to you? How it's being predominantly transmitted is via the air, respiratory droplets. And so say if I coughed or if I sneezed, then viral particles would come out of me and then be aerosolized in the air. And they can suspend in the air for several hours. So let's maybe quantify it so it becomes a little more tangible for people to understand. If I sneezed, say I would release 1,000 viral particles. And so those are in the air right now. And what you're trying to accomplish with the mask is to filter those viral particles so they do not enter your lungs, because that is where the virus is ultimately entering into the human body. People are breathing it in. And so the concept behind the mask is to prevent the virus from having access to your nose, your mouth, and then ultimately your lungs. So if you're at the grocery store and you're touching a bunch of objects, virus would then most likely get on your fingertips or on your palms. And so what you want to do is prevent that virus from getting on your hands later on when you might touch your face. And so the appropriate way to take off your gloves would be to pinch what we say the distal most part of the glove here, and then roll it in this particular fashion. So the concept is that the inside of the glove is sterile and the virus is on the inside. And then you would do the same thing with this glove on this side, and then you can touch them like this because this would be considered clean. And then you could discard the gloves.